Hi, my name is Petula Griffith. I'm a registered nurse with additional training in foot care. I'm certified by the American Foot Care Nurses Association. November is Diabetes Awareness Month, and in collaboration with GEHWOL, I want to bring our attention to the diabetic foot. Diabetes is considered to be an epidemic. It is a chronic condition where the body does not produce either enough insulin as pertains to the type 2 diabetic, or it produces no insulin where one is considered to be a type 1 diabetic. As a foot care nurse, when clients come in to me for foot care, some of the things that we notice, that we see, that are important, that we bring attention to clients. One, what does your skin look like? Oftentimes, because of high blood sugars or because of circulatory issues, clients will present with dry skin. If a client's skin is dry, we want to look for breaking in that skin. If there's breakage, there is a risk of infection. There's a risk for ulceration. Two of the infections that we tend to look at are the diabetic, that they tend to be prone to. Diabetics have a higher occurrence of cellulitis, which is an inflammatory skin condition. And this occurs because it becomes opportunistic. Bacteria steps in, and what does that look like? The skin becomes red, it becomes inflamed, it may blister, it may become itchy. So this is something that we have to look out for. We look between the toes. Between the toes, we may observe not just dryness, but because of increased moisture, especially in winter months when feet are in shoes or we wear socks constantly. Some people may have close web spaces. Your toes come very close together. So we'll observe that there will be an increase in moisture in that area. So the skin between those toes, we describe that as interdigital maceration. They are often white, they are peeling because they are absorbing that moisture and retaining it. That is not to be confused for athlete's foot or tinea pedis. The other situation that we look at in diabetes is fungus. Diabetics tend to have an increase in fungal infections on the nail plate, on the skin, because of increased glucose levels. When the diabetic client comes in, we want to be able to inspect the feet. After inspection, we want to cleanse the feet, dry the feet, and apply a hydrating lotion to the foot. Here, I'm going to do an inspection. As we examine the foot, we examine from the shins, come right down to the dorsum or the top of the foot, the soles of the feet or the plantar surface, in between the toes, checking for maceration and dry skin, and also the toenails. When I'm looking at the skin, I'm looking for dryness. I'm looking for any new growth. Diabetics have the tendency, because of poor circulation, to develop dry skin. So when I'm looking at the skin, I'm looking to see, is my client, does she have any open areas? I'm looking to see, I'm examining the skin again, checking to see, does she have any new growth, he or she, any new growth, any irregular growth or moles appearing on the skin. As I come down to the dorsum, I'm checking for temperature. Is the foot cool? Is it warm? I'm ascertaining pedal pulses. This is going to tell me if my client is having good blood flow to the feet. As I look between the toes, is she or he developing moisture between the toes? Moisture can cause cracks. It can lead to ulceration. I'm looking at the toenails. I want to ensure that her toenails are straight across. that there are no spicules, no areas of involution. I want to see that the nail beds are healthy. Are they pink? Does she have good capillary refill, which is usually less than 3 seconds? As I go to the plantar surface or the soles of the feet, I am also examining the skin as well for any color changes, any new growth, any moles. Once this is finished, I'm going to have a discussion with my client about my findings and then move on to cleansing the skin. In cleansing the foot of the diabetic, some people shower some people shower daily, others shower maybe 2 to 3 times a week. However, in care of the diabetic foot, it's important for us to wash and dry the feet every day. In using this foot bath, my recommendation is not to go beyond the ankles and having the feet in the bath no more than 5 minutes. 5 minutes is sufficient to cleanse, to go between the toes. The warmness of the water is even going to be therapeutic for the client. Once this is over, no more than 5 minutes, I take the feet out of the water. As I dry the skin, I want to ensure that I am patting the skin dry, ensuring that I maintain the integrity of my client's skin. I gently use my towel and I go between each web space, ensuring that it's dry. You will observe as you're drying in between the web spaces that you see dry skin coming off, and that's okay. Nails should be cut straight across. Exfoliation of the sole of the foot is very important. This is usually done. One of the best foot files that I recommend is the Biosana foot file. Here I'm using the coarse end of the foot file. To non-aggressively remove any dry skin from the foot, and the client will follow up at home with this at least once a week. Rehydrating the skin or moisturizing the skin of the diabetic client is very important. I am using the Lepidro formula from GEHWOL, which has 10% urea. This percentage of urea provides moisturization in deep layers of the skin. I'm going over the surface of the skin and I'm not going in between the toes. For the client with cracked heels, I would recommend the Salve Cracked Heel formula, which restores the elasticity of the skin and allows those cracks to heal. GEHWOL has a great foot care line that I personally use and suggest for my clients. These products are urea-based products. Why is urea so important? Urea is important because In its preparation, it functions as an emollient that are essential in the management of dry skin conditions. Emollients moisturize dry skin by reducing water loss from the epidermis, resulting in softer and more supple skin. Some of the other factors that we look at in urea is their hydrating effect, their cherolytic effect, regenerative effect. It also helps to increase the penetration of other substances. For example, if you're a person with eczema using corticosteroids, it increases the skin hydration. To prevent foot problems, it's recommended that diabetics do a daily cream application to their feet. This is going to avoid dryness. It will help to strengthen the skin's barrier function and protect against callus formation. Home management is very important for the diabetic client. It's important to do a daily inspection of the foot, encouraging the client to do just as I did at my office. Look at the skin, examine for dry areas, foreign bodies, any change in color. The client can also use a mirror to look under their heels and on their plantar surface. I'm going to also encourage them to go in between the toes, looking for any breaks in the skin, any redness, any dryness. Look at their nail beds. Is there any change in color? Is there any damage? Any breaking, any brittleness of the nails? After inspection, the same things, the same steps that were used here. After inspection, the client is going to wash their feet, warm water, not exceeding 100.4 degrees, 97.4. They can check with their elbow or they can use their fingers to see if it's tolerated. It is not necessary to soak. You can use a washcloth, dilute your soap at home, wash the feet, pat dry, and examine and dry in between the toes. Once this is finished, you're going to use a moisturizing product. At the office, I use the Pedro 10%. GEHWOL also has the Express Foam formula. We have the hydrolipid cream. There is also the salve for cracked skin that can be used to resolve cracked and dry skin on the plantar or the soles of the feet. Once this is finished, you place powder in between the toes to ensure that they're kept dry. The foot powder by GEHWOL is a good product to use to maintain the dryness and to absorb moisture between the toes. Once this is complete, you put on a clean pair of socks. Again, non-constricting, non-binding, white, seamless at the toes, easy to go up. Diabetics are usually encouraged by their providers to use diabetic socks. What really are diabetic socks? Diabetic socks are non-binding socks. They don't have a band at the top. They are non-constricting, not causing creases or tightness around the skin. They're often white in color, which allows the client or the patient to see if there has been any injury to the foot. The white color allows it to be easily seen. The toes are usually low seam, reversible, or seamless. Diabetic clients tend to have neuropathy and may not pick up friction against the toes, which again can cause bruising or ulcerating. I'm Petula Griffith. I'm your foot care nurse. Feel free to visit me at my office in White Plains, New York. You can book online at the www.thefootcarern.com, or call me at 914-861-5929. I can address your diabetic needs and connect you to resources that can change your outcome.